Hi! Welcome again to my Never Wonderland. I am Elspeth and this is episode 6 of our IVF Journey series. In this episode and in the coming episodes, I will try to tell you as much details as I can remember about the whole IVF or in vitro fertilization procedure that we have gone through. But first, a recap of the 5 major steps in IVF. 1, the egg or ovarian stimulation. I forgot to say that in my previous episode because it's actually the ovaries that they are stimulating. And then 2, egg retrieval or ovum pick-up or oocyte pick-up. 3, fertilization of the eggs, whether manual or by intracytoplasmic sperm injection or ICSI. 4, embryo culture and blastocyst stage. And then 5, the embryo transfer. As I have mentioned in the previous episode, each of these steps can be done in a slightly different manner depending on the preferences of the OBGYN, which is of course based on their assessment of their patient-specific conditions and needs. In our case, we have been working with our IVF doctor for almost 2 years already, including the months of break from the workups in between. We started seeing her in April of 2018, right after my first or my second RASPA or DNC from my previous OBGYN. Anyway, she ordered, the new IVF doctor, she ordered and performed my second HSG, the hysterosalpingogram, the following month, May. And then she worked us up for the 2 IUIs or intrauterine inseminations and performed the procedures herself. First IUI was in June, second was in September, all 3 procedures done in the same year. But as we already know, those 2 IUIs were not successful. And then we took months of break from the workup after the second IUI because of the holidays and because husband was hospitalized twice last January. We took care of his health first, lots of follow-up, check-ups, a lot of medications and cardio tests to make sure that he doesn't have a heart problem. And thank God he didn't. Then he finally got serious and really committed in losing weight and eating healthy. Because, by the way, that's one of the many advice given to us by all of our previous OBGYNs. For both of us to eat healthy and stay healthy, and for husband to lose weight. Apparently, a healthy weight increases the chance of pregnancy and having a healthy baby. Being overweight affects the libido or sex drive and causes hormonal problems. It also affects the quality of the eggs and the sperms and thus reduces the chance of getting pregnant. By August of 2019, we were ready to begin with the IVF preparations. We were ready physically and financially. Husband lost a lot of weight already by then, around 20 kilos. Impressive. One good thing, I think that's one good thing that came out of the hypertensive urgency scare and his hospitalization. His sperm count and the quality also improved. First order of business was to get several blood tests for both of us. For me, are the following: AMH or anti-Mullerian hormone, FSH, follicle stimulating hormone, E2 or estradiol or estradiol, I don't know how it is pronounced. For LH or luteinizing hormone, pap smear, a procedure for screening cervical cancer, rubella, German measles, HBsAg or it's a test for hepatitis B virus, and then HCV or hepatitis C virus, and VDRL, Venereal Disease Research Laboratory test, which is a screening for syphilis, and then finally HIV/AIDS. human immunodeficiency virus / acquired immunodeficiency syndrome. The first three, AMH, FSH, and E2, are hormones that are tested to measure a woman's ovarian reserve. I've already mentioned this also in the previous episode. To explain it simply, each of these tests can indicate the number of the eggs remaining in our ovaries. But for a more complete and holistic picture of the whole ovarian reserve and the general fertility of the female, they all have to be done and their results interpreted in relation to one another. As I've said, as women are born with all the eggs that we will ever have in our entire lives. And the number of these eggs and their quality decreases or deteriorates as we age. I cannot emphasize that any more than that. LH, on the other hand, it helps control menstrual cycle and triggers the release of an egg. So this measures my ability to ovulate. The other tests, I think, are self-explanatory as to why they should be taken, of course, to ensure that I don't have those diseases before creating and carrying a human being inside me, right? For husband, there was only the HBsAg for the hepatitis B and HCV for the hepatitis C and VDRL and the HIV AIDS. Thank God we passed all those tests with flying colors. Especially me, who has been told by my OB that I have the ovaries of a teenager because I still have a lot of eggs in my reserve. So, woohoo! And another woohoo because we have now an AIDS-free certificate. What a relief! Anyway, I don't have a detailed breakdown of the cost for each test, but total for all of them was 15,460. The pricey ones are the AMH, FSH, E2, and LH. They were bundled together in one receipt. So, and together they amounted to 10,100. I think it's the AMH. It's the most expensive. And then just 4,600 for the rest of the test for both of us. Plus the 760 pap smear because it was done in a different laboratory. By September, we started with the IVF step 1, the egg growth and development or ovarian stimulation. Here are the injectable medications prescribed to me for 10 painstaking days starting on my cycle day 2 or second day of menstruation. Every morning we injected 2 ampules each of folitropin alpha. It's a solution containing FSH and menotrophin or human menopausal gonadotropin. It also has FSH and HCG-driven LH activity. These are just generic names. Okay, I won't mention the brand names anymore. The folitropin alpha was 4,000 pesos each ampule of 75 IU. The menotropin was 8,000 per ampule. I will not attempt to explain in details what these medications do, except that they stimulate the ovaries and eggs to grow and mature more than the usual 1 egg per cycle. The goal is to have as many mature eggs as possible to harvest or pick up during OPU day. That day is supposed to be on cycle day 14 or 3 days after the last injections. On day 5 of the injections, I already have a few mature eggs, but there are still others that are still growing. So another medication or injection was added. It's cetrorelix acetate to be injected in the afternoon. It's a synthetic decapeptide with gonadotropin releasing hormone or GnRH. Antagonistic activity, whatever that means. This will all I know is that this will inhibit the maturity of the already big eggs, so they can wait for the other eggs to grow and mature as well. Cetrorelix costs 6,000 pesos per ampule. Folitropin alpha was increased to 3 ampules per day to help the other eggs mature faster, and the injection days was extended for another days. So now we have 11 days all in all. Target is to harvest 8 to 15 mature eggs. By the way, this is the conventional way of stimulation. The more eggs, the more chances of winning. Other clinics, they opt for a minimal stimulation, lesser medication, producing only 5 to 6 eggs. As I've said, there are differences in the preferences and approach in IVF. On day 7 of the injections, husband opted to go to the fertility clinic and deposit sperms in advance prior to the OPU day. This is just some sort of insurance, just to ensure that we will have sperms ready to fertilize the newly harvested eggs. The usual procedure is to submit the sperms on the day itself. You know, the fresher sperms, the better. However, our doctor told us a story about the previous patient that made us decide to have this insurance. The husband of the previous patient, for some reason, maybe stress or pressure, he was not able to masturbate and provide sperms during the OPU day. And since there can be no other way or no other day to do this, he had to undergo microscopic testicular sperm extraction, or micro-TESE. Others call it testicular sperm extraction aspirate, or TASA. Basically, it's a procedure that takes the sperm directly from a testicular tissue that is removed from the testes or from the man's reproductive system. And that would be another pricey procedure. I forgot the cost estimate given by our doctor, but I think she mentioned something around 100,000 pesos. Yikes. Of course, we don't want that. So, the sperm insurance submitted by husband will be frozen, or was frozen, and then to be thawed on the OPU day, just in case husband is unable to deliver. The freezing of the sperms was 5,000 pesos. On day 11 of injections, we went to the fertility clinic for a new blood test for the E2 and LH. Just an update to see the hormonal development after all those injections. That cost 2,700 pesos. On this day, we were also given a list of requirements to bring on the OPU day. And then at exactly 8 p.m. of this night, when we got home, we injected the last, the most complicated, and the most crucial in timing of all the injections. It's called chorionogonadotropin alpha injection. It's a recombinant human chorionic gonadotropin, or RHCG. It has to be at 8 p.m. This stimulates the release of the mature eggs just in time for the OPU day. This one is in the form of a pen injection, and it costs 5,000 pesos. It's just one shot. All of these injections, by the way, are administered subcutaneously, or SC, through fats of the body. In my tummy, just anywhere just under the navel. Here are the used syringes. So that, and yeah. And the vials containing the powder. So that, there. The three meds, the 3 stimulating injections. And then for the final, this is the chorionogonadotropin alpha injection. It's big. It's in a form of pen. Anyway, I guess I could create a separate video montage of these medications. I think I have a couple of clips, of short clips in my phone. One with my husband injecting, and one with me injecting. He only did it twice because his hand is shaking, and it gave me bruises. So he just took on the role of mixing the solution and the powder that is here. The solution is right here. There. It's a highly critical job because there's no room for error. Besides, it's expensive, you guys. I think that's it for now, before this episode gets too long. Bye for now. Thank you for watching and see me in the next episode. Bye!